Dr. Donald Hohman, orthopedic surgeon with the Texas Orthopedic Associates in Dallas, Texas. I'm a board-certified, fellowship-trained joint replacement surgeon. I specialize in joint replacements of the hip and the knee. When it comes to hip replacement, oftentimes we'll do a partial hip replacement for example, if somebody breaks the neck of the femur, and those are patients that are oftentimes elderly with fragility-type fractures. Generally, we do hip replacements for patients who are very active, needing a pain-relieving operation, and that entails resurfacing both sides of the joint, both the socket and the ball portion of the hip joint. And those are hip replacements, when done for the right reasons, probably the most successful operation in the history of medicine. Very good pain-relieving operation, restores function and pain relief very reliably.